Hi everyone, my name is Patel and the title of my poster is Sensory Integration Intervention for Self-Regulation Amongst Children with Autism Spectrum Disorder. So due to the high prevalence of children diagnosed with autism spectrum disorder experiencing difficulty processing and integrating sensory information, participation in activities of daily living and social engagement is restricted. Thus, my research question is, amongst children with autism spectrum disorder, which interventions related to sensory integration improve self-regulation? A systematic review was performed, and the process was guided by PRISMA. 12 studies met the inclusion criteria and thus were included in this review. The studies were critically appraised and levels of evidence were recorded. So there were 7 studies that examined effects of sensory-based interventions, such as using weighted vest, therapy ball, and brushing. There were 3 studies that examined effects of combined sensory-based intervention, and the remaining 2 studies examined effects of sensory integration therapy. The findings from this review suggest that SIT has emerging evidence for positive outcomes for self-regulation when compared to sensory-based intervention. However, the evidence for SIT is insufficient, cannot be generalized across various settings due to variations in implementation and ineffective outcome measures. My doctoral experience was at Srimati Kamlaben Patel Institute of Physiotherapy and Occupational Therapy in the state of Gujarat, India. It is the only university that has an OT program in the state, and it has a small pediatric outpatient clinic that is run by the faculty and fieldwork students. I was able to lead multiple projects, such as developing home modification and sensory activities resources sheets for the caregivers to take home, advocating for OT by forecasting the need for improvement in the facility. I participated in community-based rehab clinic and at a sensory integration seminar, and I presented on sensory integration and autism spectrum disorder to the final and interning students at the university. So I was able to attend the 57th Annual National Conference of AIOTA, which was held in Mumbai. It was a 3-day conference. AIOTA stands for All India Occupational Therapists Association. There were 6 scientific sessions where practitioners presented their studies and novel program implementations within the community that they had implemented. There were international delegates from the United States that came to participate in guest lectures and faculty panel discussions. Other events during the conference included welcome night, cultural event, scientific exhibitions, poster competition, and competitive street play that highlighted the theme of the conference, which was cognition, mobility, agility, stability, ability towards functional independence. So based off my literature review, amongst children with ASD, it is recommended that sensory integration therapy be used to improve self-regulation. So needs assessment was conducted to understand the needs for the facility in order to implement the SIT intervention protocol. It was determined that the following social determinants, such as low levels of education, poor health literacy rate, low socioeconomic status, and lack of access to proper resources be considered when implementing this protocol. In addition to that, social norms, cultural beliefs, stigma, and joint family system poses greater challenge for caregivers to provide support for their children. So for my case study, a 4-year-old male client with ASD was selected to implement the SIT treatment protocol for 3 days a week for 60 minutes for 6 weeks. The caregiver response indicated improved self-regulation for the client as he showed progress in maintaining attention to goal-oriented tasks, following simple commands, increased social interaction, and decreased repetitive behaviors. Furthermore, intervention appropriate measure and feasibility of intervention measure was used to gain outcome measures. So due to the short duration of the study, environmental barriers, and limited resources, the outcomes cannot be generalized. Furthermore, in order to adhere to the protocol, few changes must be made, and environmental, social, cultural, and educational context must be considered when planning this intervention. So future recommendations is that the facility can implement SIT by installing new equipment and networking with a sensory integration practice task certified occupational therapist in order to adhere to best evidence practice. And in order to financially invest in new sensory equipment, the facility should ask for funding from the institute. Further implementation should be, future implementation should be 3 days a week for 60 minutes for 10 weeks. This is the intervention flow for the recommended SIT protocol. So a question that can be asked is, how was the sensory integration seminar? It was a very eye-opening experience. The owner is the first and only SIP certified practitioner in the state and runs a clinic that offers OT, PT, and speech therapy. The faculty and her are planning a collaboration where she can come to our clinic and offer lectures and guide our clinic in SIT interventions. What were some key takeaway points from the National OT conference you attended? A few things that I took away were the importance of clients' roles and routines and how they play effect in their occupation. There was a lot of emphasis placed on the importance of using cultural context when treating clients and making treatment client-centered in order to gain functional outcome. The last question is, what were your biggest hurdles in implementing your clinical guideline? I had to keep in mind that the setting I was in lacked some resources, such as the sensory equipment. There were environmental barriers, time constraints, and not having access to a SIP certified practitioner was also challenging in order to implement SIT intervention protocol.